Okay, now we switch to English and start the webinar. So welcome to the webinar. Today's webinar is about the regulatory assessment. We focus actually on risk assessment, which is very important. If you have new compounds, they need to be evaluated in concern of their risk before they can be put into products, and there are regulations, especially from the European Union. Here in Europe, of course, you have the FDA in the United States, and all those authorities need to make sure that the products which we use in our or the compounds which we are using in our products are safe and harmless for the consumers. This webinar is hosted by us, Conscious Basel. We are a scientific association located in Basel to bring together scientists to reveal the most fascinating topic there exists in science, namely why systems in our universe evolve such that they can consciously experience the environment. You can visit our homepage to get more information. You can also apply for membership and have a look about this fascinating topic and experience it. Today we are dealing with those compounds and the assessment of those compounds, because also in neuroscience, cognitive neuroscience, substances are essential in concern of treating psychiatric disorders, for instance. You have substances which alter states of consciousness, for instance, which you can use also to study conscious experiences and the underlying mechanisms. So the assessment and the safety of such compounds are also interesting for us, especially if you want to store such information, to make this information available when it comes to store it in a data management system or knowledge infrastructure. So what is a knowledge infrastructure where such information is accessible? So we will talk about this. Then we will switch to the principle of assessment, risk assessment, compound assessment, which is part of regulation by authorities, which is called the new approach methods. So regulatory bodies want to come away from animal experimentation and try to use more in vitro systems and in silico systems to make such assessment, which is called the new approach methods, which should help in concern of sustainability and also the 3 Rs. What tools can we use in NUMS? We will have a look at those tools. The compound descriptors, which are important to correctly annotate to be able to assess the compounds in NUMS, and how such tools can be built, which might be also interesting for our association. And then if you have time, we can also have a discussion. So the knowledge infrastructure. A knowledge infrastructure is a web infrastructure, a remote infrastructure where you can get access. Maybe you need to log in, and then you are in an online environment where you can interactively have insight into information, for instance, about compounds, which you can use to make an assessment. So in a knowledge infrastructure, you might have data about compounds. Here you have a list. For instance, ethanol, LSD, dopamine, niacin, propofol, and descriptors. So you need to be able to identify those compounds. This you can do with Cas numbers, for instance, smile structures. You can annotate the PubChem ID, and you have the known biological effect. And if you have those descriptors, you can link the chemical structure to the biological effect. And then if you have a big database, you can train a machine learning or deep learning system with this data, and then come with a new compound and say, okay, the new compound has a similar structure to, for instance, dopamine, and therefore the probability of acting in a certain way in a biological system is very likely to be similar to the one of dopamine. So you can make predictions based on a big database which you have in a knowledge infrastructure with which you can train such a machine learning or deep learning model. Such databases exist. Those are validated databases from regulatory bodies. For instance, the PubChem, you might all know this, where you can enter a compound structure or a name, and you have all the most important information here. You get the structures, you get safety information, identifiers, toxicity information, and so on, which can be very useful for an assessment. You have the US EPA CompTox, which is a similar one. And so we enter the chemical structure here. It's also menthol. You see over 1 million different chemicals where we have safety data, GHS data, hazard information, which you can use as a bioactivity of this compound, which you can use to train a machine learning model to predict new compounds based on this data, for instance. You have the NTPIs. You can also assess a list of compounds. Let's put in one, then you can run the search. And then you see all the information about its toxicity. So how likely is it to induce cancer, liver toxicity, endocrine disruption, and so on. You get all the data, which you can also export and also use for making assessment or training a machine learning model to do assessment or build assessment tools. If you are doing toxicity, you can go to the SIN list. It's a list of compounds. I think it's like 800 or 900 compounds, which are highly concerned, highly probable. They are very toxic. Let's say like this. If your compound, I mean, it's mostly for cosmetics. If your compound is in this list, you must not use it for producing a cosmetic product because it's toxic. The same you have in this OEHHA. It's a list of toxic compounds. If your compound is in this list, you are not allowed to use it by regulation, by law. And yeah, PubMed, there is a lot of information and publications also about compounds. And then the ECHA database, which is also similar. Let's search for menthol as well. Also here you have hazard sheets and so on with information which you can use. And if you're doing assessment, it's most commonly that you take the information which is stored in those databases into your own database. You structure all the information and the data so that you can use it for training your machine learning or deep learning model. Extracting data by hand manually is very challenging, especially if you have 10,000 of compounds which you want to have in your database. So there is an example which was developed by Edelweiss Connect, which is automatically taking data from those databases and which you then can use and put in your own database. It's a Python script-based tool where you see here, you can enter your CAS number. You can specify the sections. Here it's from PubChem, so you need to know what sections are in PubChem. You can put it here. You can run the search, and you get an overview over that data which is in that section, which you can export then. You can do the same for PubMed. Here, for instance, you can select the range of years in which the publications have been published, where you are interested in, the number of publications, and then you can also enter keywords by which you would like to search. You can run the search, and then you get all the information from those publications which have this keyword in them. So that's quite helpful if you want to extract data out of databases. and to take it into your own database. The database itself, which might be integrated with the knowledge infrastructure, needs to be built in a way which is accepted and validated by authorities. And this is based on one principle, most likely, so the FAIR principles. FAIR means findable, accessible, interoperable, and reusable. This is a basic rule in data management which you need to apply if you're doing data management. This means you need to have an infrastructure where you can search the data and which is interactive. It must be available. You need to get access to, need to download it. Others need to use it. And you yourself should also be able to use it. Those FAIR guiding principles, you can read all about it in this publication. And the knowledge infrastructure should also consider experiments. So if you're doing experiments to generate new information about the compound, you should store all steps of this compound or the experiment which has been done with that compound so that you can verify what descriptors of the compound have an impact on its activity. So you need to concern the study itself. So who did the study? What study was it? By whom was it initiated? What were the study components? The setup. What biosamples did you use? What materials did you use? Or what synthesis parameters did you have for synthesizing your compound? If you were doing imaging, what instruments did you use? When were they calibrated? If you were doing image analysis, so what image data did you use? What analysis tools did you use? And how did you get your results and how did you analyze the results? Image correlation, so how does the features on your image, which you can detect, so if you have, for instance, graphene, and you want to detect features of this graphene material on your image to the synthesis parameters, for instance, this is the image correlation, where you can say, okay, we see now if you always have a high steering rate during synthesis, we always get sharp edges, graphene edges on the images. If we lower the steering rate during synthesis, we don't see those sharp edges, they are more round. And if you are doing then bio experiments, then you might see that the sharp edge graphene material always induces toxicity, while the round one does not induce toxicity. So you can relate the features on the image to its biological effect, the toxicity, and you can say it is influenced by the steering rate during synthesis, for instance. So this is very important to get all the descriptors during an experiment to be able to validate your compound. Yes, so as we said before, this information needs to be structured and entered into a knowledge infrastructure. And normally you can do this by having different steps. So the first step might be you submit a protocol, either a synthesis protocol, a sample preparation protocol, a measurement protocol, or a data treatment protocol. The synthesis protocol, if you would submit a synthesis protocol, you would submit it online in this knowledge infrastructure where you first need to log in and then get to this environment. And while submitting the synthesis protocol, you need to enter the synthesis parameters. So for instance, you would say, for this protocol, the synthesis temperature was 42 degrees Celsius. The steering rate was high, medium, or low. And then you put all the descriptors for the synthesis protocol. The same you can do for your sample preparation protocol. Which method did you use? Who did the sample preparation? Under what conditions? Also the measurement, what instruments did you use, what acquisition did it have, and so on. And also the data treatment protocol, what analysis software did you use, and so on. But for each protocol which you submit, you already have all the descriptors linked to these specific protocols. So there is a protocol sections where you can also search for the protocol submissions, download the protocols, because you can also attach the PDF documents, for instance, which you then can also download. So they are submitted. And then in the second step, you would go through the data submission workflow, which is based on this REMBI concept. So you would come to section 1 where you give the main data. And it's mostly drop-down menus. So it's a which projects are you working for? Then you choose your project A or project B, and then you submit this by clicking OK or whatever. The second would be the material. What material did you use, or what material did you synthesize, or whatever? You choose the material. This is also a list because you have to create this material. And to this material, a synthesis protocol is already annotated. So by choosing the material, you already have all the descriptors for the synthesis of this material which you choose here. So you have the descriptors. Then you choose the biosample. Which cell did you use? Also here, you would have all the descriptors. Then for this, you would go to the sample preparation protocol. You will be asked what sample preparation protocol did you use. You will choose the one which you have submitted here from a list, and you submit it. And the same for measurement. Which measurement protocol did you use? You choose the one which you have submitted here. You go to the next step, data treatment. Which data treatment protocol did you use? You choose your one and submit it and go to the results without P, results. And there you provide all the results which you got. For fluorescence, it might be a fluorescence intensity, which you enter. There you have a value, you have a unit, and you have certainty, so an error range, which you also need to provide. So the error range is also considered in those results. If you have images, you can upload the images, which directly will be linked to Omero, which you can also integrate. Omero is a FAIR-based image data management tool, let's say. You can also upload data in PDFs or doc format and so on to support the data which you have has been submitted here. You can review your submission and then submit it to the database. And then it will be also findable through search and structure, and then you can use it. You can use it, for instance, to make this data correlation. So you can apply it to machine learning models or deep learning models, which make this correlation between the features in the image to the synthesis parameters and the results which you got, and then detect patterns within the whole process, which you can put onto a one-page summary. The European Union has made an initiative which is called the Digital Product Passport, where for each product they want to make a one-page product passport where you have the sustainability data, the toxicity data on this passport. It's digital, you can access it. And the European Union is trying hard to make such a passport for all known products in concern of safety. So you can make such a passport also as a reporting system where you have all the different parameters, results, and correlation results put on this one-page reporting format, which would be standardized as well. Yes, Digital Product Passport. If you want to read more, you can find it online. It's called Digital Product Passport. Yeah, so this is an example of how such a data submission environment would look like. This is also from Edelweiss Connect. They worked on the Accords project. It's a graphene project, the European one, where you see here the sample. The sample you would put in a name, a sample name. All the fields with a star are mandatory. You can select a phase, like was it a powder, was it a suspension, and so on. Here for the nanoparticles, You have also the crystalline phase, shape, and so on, which you can submit. And then you have those parameters annotated to your compound. Oh, this is actually from ACE Nano. Yeah, this is also a European project in concern of product safety and material safety. Yeah, so you heard a lot about databases and descriptors for compounds. So how does this help now to make a compound safer? You need to assess it. So, and for assessment, you need to have tools. And to have tools, you first need to understand the biological mechanisms which are going on in the human body, or in an organism, let's say, so that you can develop measurement systems to be able to make statements about the endpoint. Here is an example. The example is skin sensitization. For skin sensitization, we know that there are 1, 2, 3, 4, 4 key events, they are called, so biological events by which we can identify the endpoint skin sensitization. So if you have a molecule, it comes to your skin, it covalently binds to skin proteins. Then you have a keratinocyte activation. In the third step, you have a dendritic cell activation. You have then a T cell activation, which in the end leads to the skin sensitization event. And each of this step, first of all, you need to be sure that it is a very important pathway and that you don't have side pathways which might influence or mess up this strategy. And then you need to develop measurement systems. So here, for this covalent binding of molecules to skin proteins, you have the direct peptide reactivity assay. It's an in vitro assay where you can measure how likely a molecule binds to cysteine and lysine parts of proteins. Then you have the keratinosense assay, which measures the keratinocyte activation. You also have Lucens and the Sense-IS. Those are not officially validated ones, I think. I'm not sure about this. The European Union has OECD. No, the OECD has guidelines which describes the keratinosense assay. So they say you need to do those assays so that you can make a statement about skin sensitization, and keratinosense is one of them. They also say HGLAT, so all the green ones. HGLAT assay for dendritic cell activation is a validated assay, in vitro assay, which by regulation, by law, you're allowed to use for regulatory skin sensitization assessment. But you also have here other ones like GARD skin assay, for instance. And this LLNA is actually in vivo experiment. It's a local lymph node assessment which you do. So you do it on the skin, but also here, I mean, you have now skin models which are very, very good. So you can maybe in the future use also in vitro models for replacing the LLNA. And then you can also do modeling. So based on what we have discussed before, so you know the structure, you know the biological endpoint, you can use such machine learning trained models which say, okay, based on this chemical structure, the likelihood of this compound being a skin sensitizer is very high. And then you need to integrate all those results to score your chemical or your compound to say, okay, because this compound has this score, it is likely to be a high sensitizer. This is all regulated. So some assays which you can do for neurotoxicity, you see here, there are some in silico in vitro assays. You can do neurotoxicity assessment. You have in vitro systems by this company Tissues. They have organ on a chip systems where you can check for the interaction between different cells, like liver, kidney, neuro, intestine, liver, kidney, neuro plus blood-brain barrier. You have here the University d'Artois is focused on blood-brain barrier assays. So they have in vitro ones. You can also model in silico the blood-brain barrier passage probability of a compound. So there is a lot of research going on and also assessment. Then you have pluripotent stem cell assays. Then you have here biobites. They're using zebrafish embryo, which by law is considered in vitro and not in vivo. So you can make assessments for Parkinson's, Alzheimer's disease, epilepsy, and so on, and include the outcome of those experiments with the data which is already known, with the in silico predictions to score your chemical in the end, a compound in the end, and you can, of course, check for different endpoints. And, like ion channel activity, neurochemistry, neuroanatomy, if you're doing immunohistochemistry, for instance. This you can do by starting, for instance, the cell proliferation, apoptosis, cell migration, growth, and so on. Yes, and the thing is, how can we trust the data and the results which we get? It's very hard to trust such an approach, and therefore all the assessment needs to be standardized. Everyone needs to do it the same way, under the same conditions, in a regulated way, so that in the end we can say we have a validated procedure, everyone is doing the same, and therefore we can also compare the data. But this is not enough. Sometimes, especially when it comes to in silico assessment, we know that in silico systems are still not very good. So you need to annotate a significance factor. So how much can you trust this outcome? And this you also need to annotate. And therefore, you have a lot of regulations. So for skin sensitization, for instance, you have this OECD guideline 497, which is referencing to a lot of other guidelines as well, which says you need to do the DPR, the keratinosens, and the age-clad assay. You need to do the in silico assessment. You need to integrate all the results. And based on this, you need to score your compound. For neurotoxicity, you have here the European Union guidances for first tier. So tier means actually, if you assess a compound, you first use methods and tools which are cheap, which are straightforward, and maybe they give you a clear result. If they don't give you a clear result, you need to invest more time, more money, and better tools in a second tier, so in a second approach. This will be the second approach. You have single dose, repeated dose guidelines, test guidelines, a lot of them which regulates how you have to test. And here, yeah, this is for developmental neuroscience. You can also do developmental neurotoxicity. This is an upcoming field with a professor here in Basel, Ellen Fritsche. She's a director at the SCAT, the Swiss Center for Human Toxicity. She has helped developing this guideline for doing developmental neurotoxicity. So you see here, it's the corresponding author. Yeah, so how does such an approach look like? So you see here, this is the skin sensitization approach, where you have here the DPRA assay, the age-clad assay, and in silico assay. There, for instance, you do a measurement and then you see, okay, you got 30% of cysteine depletion in the DPRA assay. Then you go to this list and see, it's here. You need to score the DPRA assay by a score of 2. And then you do the SENSAI-S assay or GARD. Let's do the age-clad assay, the one which is described. And you say it has a score, it has 150 micrograms per milliliter. And then you see, it's also a score 2. And then you do the QSAR toolbox in silico assessment, and it is positive, then you score it as a 1. Then you need to sum it. 2 plus 2 is 4, plus 1 is 5. Then you go to this list, 5 is here. So this compound is categorized as a UNGHS1B compound, which means it is a weak sensitizer. So this is a weak sensitizer. 1A would be a strong sensitizer, and 0 to 1 is a not classified one. So in your regulation, you never say a compound is safe. you just say you did not detect a concern, because you cannot never be sure 100%. Yes, so such tools, in silico tools, for instance, there is actually the validated OECD QSAR toolbox, which has actually, yeah, it's a link. Let's go there. Almost every endpoint which you can imagine: liver toxicity, neurotoxicity. It concerns. It also takes into account metabolism. So it has a huge metabolite evaluation, which it is giving to you. So it's absolutely awesome. So if you want to use it, you can download it and use it. It's open source. It's for free, but it only runs on Microsoft and not Mac, unfortunately, because I'm using a Mac and I would love to use it. The same for Vega. It's a validated toolbox, which is open source. You can download it. And when it looks like this, actually. So here you have the first step. You enter the SMILE structure of your compound. You submit it. Then you go to select. And in the select part, you select the endpoint which you're interested. So there is also ecotoxicity. You can assess LD50 and so on. You choose the one which you would like to have. Then you click on export, and then it is making all the assessment for you and giving you the assessment results in form of a PDF. And for toxicity research, you can also use ToxTree, which is a random forest model, which you cannot read very well. But you also enter a SMILE structure, you press the button, and then you get all the results and concerns about this compound. It's actually quite cool. Yeah, so here, for instance, you see the OECD QSAR toolbox, how it would look like. So you have here also the input thing, then you have a profiling about different mechanisms. You have a data gathering point where it gathers data from different databases. Then it has a QSAR approach, which means a quantitative structure activity relationship approach, which is an in silico computational tool which you can use and apply to assess the compound, and then also the reporting. And important in reporting is not only how you did the assessment, you also need to submit a QSAR reporting format sheet, which contains all the information about the in silico system itself. So what was the training set of that QSAR model? What was the testing set? What is the significance of or the performance of that tool? And when was it developed? What software version is it? This is all information which you can find in the QMRFs, and each QSAR model which is doing such a prediction has a QMRF, which should be considered in reporting to authorities as well. So also here you see for each model, when you go to select, you also have the QFAR. Here, for instance, you see the different endpoints on human toxicity. You see, you can assess genotoxicity, mutagenicity, carcinogenicity, cardiotoxicity, skin sensitization, cognitive function defects. And for each of the endpoints, you have different models. So you can have several QSAR models for one endpoint. You see here, this is all the different in silico models which they used for one endpoint. And each one has a QMRF, so you could click here and download the PDF. It's on the homepage. And this is the ToxTree, actually. So how QSAR works, you see here. So you can apply different computational approaches or methods to do QSAR modeling. So you can do read across, which is actually comparing the chemical structure to known chemical structures, making a prediction. You can do random forest, which has random forests in a decision tree, actually, which in the end gives you results. A multiple linear regression, which is predicting based on linear regression, as it says. The artificial neural networks, which can be also trained. So it compares the output to the input and adapts the connectivity here. and the Bayesian networks, which is actually based on those nodes, and the connectivity between those nodes, and the nodes represent information which is correlated with each other to make a prediction. So those computational techniques you can use to build your QSAR models, and all the QSAR models are based on those mechanistic approaches. This is the Vega example of a report. After you have applied the QSAR, you will get such a report. You see here the prediction. What endpoint was it? Mutagenicity. So here you have a yellow prediction, meaning that it's most likely not a mutagenic compound, but the reliability of this prediction is very low. So you know it's not a mutagenic compound, but you cannot be really sure. So this needs to be go into the result. For instance, the applicability domain you also have in the information of the report. Applicability domain means if you build a QSAR model only with compounds which contain benzene rings, then your in silico model is trained on compounds containing benzene rings. Then you cannot come with compounds which do not contain a benzene ring, because the reliability would be very bad of the prediction. And maybe the prediction cannot even be done because it was not trained on non-benzene compounds. This means that the compound does not lie in the applicability domain of the benzene trained in silico model. So this is this information. Is your compound in the applicability domain of the QSAR model? Very important as well. And then, as I said, you can download the QMRF. This is this reporting format of QSAR models. And you see there is all the information which you need. Who built it? What version is it? What was the training and test set? And so on. For instance, they have the training set mentioned, and then you can maybe also access and download it. It's actually all open source. So the OECD QSAR toolbox shares the training and the test sets. The Vega toolbox as well, and this is from the Vega. So this is the endpoint LD50, and this is the training set. And so you see you have a compound ID, Cas number, or SMILE structure. You see, was it a part of the training set or the test set? And then you have the value. So you have an experimental value where they experimentally tested the LD50, and you have then a predicted value, which was predicted by the in silico system and tool. Yeah, and you see, maybe it also has a difference. So an indication that maybe something is not working very well. Yeah, sometimes you have very close ones. So this is already a part where you could analyze a lot of stuff. Training sets, yes, and test set. And yes, to do this assessment, you need to give the descriptors. There is actually an example which is called SaferSkin toolbox, which was also developed by Edelweiss Connect, where you actually, here, this is skin sensitization. And you see here, they are using different QSAR models. They have a 2 out of 3 approach. They have OECD ITS, integrated approach, which is the one which I showed you before, the regulated one. They're using multiple regression, neuronal network, and Bayesian network. For the OECD 2 out of 3, this means you enter the DPRA assays for cysteine and lysine depletion, you enter the keratinosense result, and you enter the age-clad results. And if 2 of them are positive and 1 is negative, the result will be positive. If 2 are negative and if 1 is positive, the result is negative, but you should do also other approaches as well. The integrated testing strategy is the DPRA assay, the age-clad assay, and the in silico toolbox, the one which is regulated by the OECD, what we have seen before as well. Multiple linear regression, you would need to enter the vapor pressure as well, Kmax, neuronal network, GBRA, keratinosense, HCAT, and TOX3, and TIMES you can use. TIMES is also an in silico prediction tool. And then for the Bayesian network, you would need to have variables such as log KOV, log D at pH 7, water solubility, protein binding, which is actually received by the GBRA assay. And based on this, you can make a comparative assessment of your compound. So how can you build such a QSAR model by yourself? I mean, there are publications such as this one, in silico prediction of a chemical neurotoxicity using machine learning, and they describe every step very well. So what you basically do, you need to have a data set, let's say for neurotoxicity, and there are neurotoxicity databases, and they used one, and they took 495 chemicals from this ChemID plus ToxNet database. Inorganic compounds, salts, mixtures are very hard to assess because QSAR models are trained on organic structures. So in the second step, what is bad, because you also might want to assess inorganic compounds and salts, right? But at the moment, this is not really possible. So you need to exclude the inorganic compounds and the salts and the mixtures. With pipeline pilot, you can make a Smiles canonicalization, and with the remaining chemicals, here it was 422, you can divide them into a training set, into a test set. Here they use the ratio 8 to 2 training sets to test set. You need to calculate the molecular descriptors with PyBiomet. You can do this and apply a feature reduction with this scikit-learn package from Random Forest. And then you can apply a QSAR model, so machine learning or deep learning model. And there are several ones, so you can use whatever you would like to. And then in the end, you need to validate the approach which you have internally and externally, so double validation, and also analyze the applicability domain. So what did you train, and for what compounds is this QSAR model suitable? Then you need to write a QMR F. This should be a F, not a P. It almost looks the same. And then create a nice and user-friendly front end and implement the software in a nice way, a user-friendly way. Then you have a cool instrument and tool for assessment, or in general characterizing compounds, maybe detect patterns between compounds as well, and correlate data. Yeah, and do a lot of stuff. What you also need to consider is, I mean, this is very important as well, is exposure. So if you have a very toxic chemical, but you are never in contact with that chemical, nobody cares, right? So you should be exposed to that chemical. If it comes to your skin, how likely is it to penetrate through your skin? If you take it orally into your body or whatever, and it is in your body, how fast does it decay to non-toxic metabolites? How long does it last in your blood circulation system or in your blood plasma? If it is in your blood and it is a neurotoxin in the brain, I mean, if it is very neurotoxic, but it does not pass the blood-brain barrier, then nobody concerns, because it doesn't have a real effect in the brain, right? So what is the blood-brain barrier probability? And then when it is in the brain, how likely does it dock to a specific receptor and so on? And based on this, you can also apply different concentrations, where you can develop a dose response curve. So at what concentration do you see effect? Based on this, you can derive a lowest observed adverse effect level, or a no observed adverse effect level, so the lower else and lower else, from which you can apply or develop a margin of safety. So what is the concentration per day which you can be exposed to so that it is still safe for you as a human. And there are theories and publications from the OECD which say that the margin of safety for ethanol, for alcohol, is half a glass of wine per year. So very low. So ethanol would be very toxic, but there are also counter publications which say it's not really a serious study because it has some also non-scientific effects, and so there's a bit of fight and not really fair. Yeah. So but that would be the margin of safety, and this you can also include into your assessment and report it to the authorities. What you basically can have is you get the result, and either it is non-toxic and your prediction that the compound is non-toxic is true. So that is good because you have a true statement which says you can use that compound. Or neither that would be true negative. True positive would be you have a compound which is predicted as a toxin, and this prediction is true. So true positive. This is also good because you know you are not allowed, you must not use this compound. Then you can have a false positive where you get where a safe compound is predicted as a toxin. This is bad because it is not the reality, but it is not very bad because if you're not using it, then it can harm you. What is absolutely bad in risk assessment is to have false negatives, meaning that the system or your tool predicts the chemical to be safe, but in reality is not safe. So false negatives are really bad. Then you take the compound, then 1 year later you die or something like this. Very not good. So you should avoid false negatives and when possible also false positives. And how can you do this? Why do we get false negatives? So for instance, you can have compounds which are electronegative. So skin sensitization, this skin protein binding happens with electronegative compounds. Yeah, so they might be electronegative, but they might still be a reduced sensitizer because they have steric hindrance or resonance stabilization or lack of appropriate leaving groups. So electronegativity is not the only factor which is leading to skin sensitization, for instance. So you need to consider all the factors. Predicted positives may not undergo efficient bioactivation due to rapid metabolism or rapid detoxification through competing pathways. Skin sensitization, we discussed the pathways. Maybe there are side pathways which we do not know. Compounds may have reduced penetration across skin or brain, blood-brain barrier, crossing what would need to be implemented in the model prediction as well, where you can use those in silico and vitro assays, which we have seen before. Some compounds require metabolic activation. What needs to be considered? Also here, should change this. Structural similarity might not be enough. Very similar structures might have very different effects, or also if they have changed one atom, right? So this needs to be considered. You can have cross-sensibilization. So you might have a compound which is not toxic, but if you would apply another compound first, this first compound might change your biochemical environment in the organism, making the second compound, which was not toxic before, toxic in this case. So this is cross-sensibilization needs to be taken into account as well. Maybe your data set is too small. You have trained an in silico system, which is making a nice prediction, but the reliability of the prediction is very low because you have not trained it with a lot of data. So you need to have a large data set. Or maybe the underlying biological or physical pathways are not understood enough. I mean, if we would assess the probability of a compound to induce Alzheimer's disease, how would you like to do that if you do not know what's the basic molecular biological mechanisms are which give rise to Alzheimer's disease. So very hard to do, right? Yeah, the alternative pathways exist. We have it here already. The data quality is low. So if you have a lot of data, huge training sets with with results which are not true, you can forget your in silico model. Then you should check, should you maybe use a local model versus a global model? Although the models itself are not good enough. You use the wrong method, or you took compounds into your applicability domain, which you should not have not done, and so on. And this is actually described in this Notch et al. Paper, which you can also read if you want. Yeah, that's it, more or less. I mean, a lot of tools, how you can bring together data, how to use it to describe compounds, to detect patterns, which is also important for conscious or neuroscience in concern of conscious environments and cognitive neuroscience, to understand the underlying mechanisms better, to detect patterns, and how substances work in the brain. Yeah, that's it. I will stop recording now, and then we can also discuss if you want. Where is it? Rec. Stop recording. Bye for the ones who watched online, not live.